All right. Well, again, thank you everybody for joining today. I think we'll probably get a few more people coming in, little couple stragglers coming in. So welcome to today's Regional Community Coalition all-member call. We are very happy to see you guys here. I know it's been quite a wonky few last couple months, and we are just happy to see everybody keep coming to our meetings and provide updates and share their stories, their success stories. We want to keep them coming in. So anything that we can do to help support your coalitions. All right, next slide. So just a few logistics. All of you have the ability to unmute yourself. So we do have a couple presentations, but for the most part, if any of you want to share anything, keeping it pretty informal today, please do come off mute, or you can type your questions or comments into the chat box. And we do have a few polling questions, or I think just one polling question actually later on. So just be ready and answer that polling question. And again, share your experience with the group. Next slide. So for today's agenda, we have a few people talking about what they're doing with their coalitions, and then we have a few brief updates regarding Mountain Pacific. And then we have, of course, our data dashboards with our analysts, and then COVID-19 updates, and any time for questions and discussion. And of course, again, like I said, we're keeping it pretty informal. So anytime you have a question, please just put it in chat. All right, and so Mark, I will hand it off to you to introduce Ashley.
Great. We're very happy today to have Ashley Menai with us from Alaska. They've started a health equity coalition, and she was going to talk to us a little bit about what they're doing up there. So Ashley, take it away.
Hi, everyone. Nice to see you all. So I'm going to make this kind of a quick little update, as I actually have to jump off for a conflicting meeting at this time. So I'll give you guys a quick rundown of what we're up to, and would be happy to answer any questions, but also feel free to contact me after this if you have any other questions as well. So I am the program manager for the State of Alaska Heart Disease and Stroke Prevention Programs, and also the interim program manager for the Diabetes Prevention and Control Programs, as we're working on filling a vacancy for that position. And as part of my role, I support our statewide coalitions for diabetes and heart, which we call the Take Heart Alaska Coalition and the Alaska Diabetes Coalition. We're in the process of actually doing quite a few changes with the coalition right now. In response to some feedback that we got from members during our spring coalition meetings, we decided to join the meetings for our coalitions and hold our work group sessions together, our steering committee meetings together, and work a lot more closely between the two coalitions. There were quite a few people who said that they were interested in joining both, but just couldn't make the time commitments that are necessary for that sort of work. So we are in the process of doing that and rolling out those changes, but also at the same time, we're actually rolling out a new Health Equity Council, which is going to be a group of approximately 8 people who are going to be serving both coalitions, which is going to be kind of a joint coalition. The way that we are doing this, we're working with one of our contractors who is helping us with the designing and the recruitment of the Health Equity Council. We have allocated funding for honorariums for 8 people. And the goal is to find 8 community members who represent diverse cultural communities around the state of Alaska. We already have quite a few members in our coalitions who represent our tribal health organizations and FQHCs and CHWs and things like that. So we're really specifically targeting some of those ethnic and cultural groups that we don't have representation on the coalition, but we do know that they have increased risk of heart disease and diabetes issues throughout the state. Some, for example, being our Polynesian communities, our Samoan communities, our Pacific Islander communities, Korean communities. So we have pockets of these communities around the state, and actually some sub-Saharan African and Western African communities as well. And so we have these communities around the state, and we really, as of right now, don't have a good way of reaching these communities of people. And we don't have, these sort of champions within these communities who can be the bridge between our work and talking with these folks. So we're in the process of reaching out to these cultural communities and seeing if we can find representatives from these groups to serve on the coalition on the Health Equity Council. The idea behind the honorarium is that we are specifically looking for people who are not working in public health or in healthcare. The vast majority of the folks who are on the coalitions currently work in healthcare in some capacity. So the work that they're doing on the coalition fits in with the work that they do in their full-time jobs. So, you know, they're essentially getting paid from their work to also participate in the coalition. That wouldn't be the case with these community members that we're bringing in for the Equity Task Force. They would ideally be people who actually don't have a health background and really are bringing forward that lived experience knowledge instead of the health knowledge. So our goal is to provide an honorarium to really honor their time and their commitment to their community, their commitment to the coalition, and to make sure that we're respectful of what we're asking of them, since what we're asking of them would be in addition to their daily work and their daily lives that they're already doing. So let's see, I'm trying to think about what else I can add. I think I mentioned we have allocated funding for 8 honorarium spots. That isn't to say that we are limiting the Equity Task Force to only 8 people, but just that we're going to offer honorariums for 8 people. And then the idea will be for the folks on the Equity Task Force to, sorry, my cat is getting into something over here. The folks on the Equity Task Force will serve on the Equity Task Force and then also serve on the work groups as well. So they would be, they would have their own mission and vision and goals and strategies. And then they would also serve on the work group so that they would bring those strategies and those visions into the work group work and ensure that those visions are being carried through the work being done by the work groups. Let's see, I'm trying to think about what else I can mention about our Equity Task Force. We're really in the development phases of this still. Right now, we're just recruiting. So we haven't started holding our meetings for the Equity Task Force yet, but we're really excited about the direction that we're hoping it will go in. And I know that there are other coalitions within our state that are also looking at what we're doing and thinking about ways that they could do something similar as well. And I think there are a couple people here that are part of our coalition as well. I don't know if anyone else wants to chime in and mention anything that I might have forgotten, or if there are any questions I can answer.
Ashley, this is Crystal from Mountain Pacific, and I find this very interesting. How often do you guys meet?
Well, so the way we have been doing things is that our work groups usually meet once a month, and then our steering committee meets once a quarter, and then we have 2 fall and a spring membership-wide meeting for the entire membership together. We are kind of reassessing some of that just to ensure that we're not asking too much of people. Our plan as of right now is for the Equity Task Force to meet once a quarter. And then we're talking about reducing our work group meetings down to once a quarter as well, with the assumption that as we're combining our work groups, we're going to have larger work groups, which will likely break out into smaller project groups that are working on individual projects. And they can meet more frequently than that, but then the work groups themselves would meet once a quarter. So our plan as of right now is to have the equity group meet once a quarter, and then each of those people would also be on a work group that would meet once a quarter.
Awesome.
Thank you very much, Ashley. We really appreciate your time today.
Yeah, thank you so much. And again, if anyone has any questions or feedback or idea about, oh, Renee is mentioning the amount of the honorarium. We aren't necessarily looking at patients with a certain condition, but we do think it would be a plus if they have personal experience with diabetes or heart disease, just because that's lived experience that they can bring to the table. I'm going to defer the question about the amount that we're offering, only because we had been debating quite a few different options, kind of in the range of $50 a month. And I don't remember off the top of my head what we settled on as we were kind of crowdsourcing what would be the appropriate amount. But it was in the range of about somewhere between $50 and $100 a month.
This is Mary Schramke. I was on a healthcare systems research network monthly symposium today, and some folks from Kaiser in Washington State formed a patient partner coalition, and they talked about how they formed the group and their compensation, and they actually did some math. And well, they initially started out at $40 a session, and then once they really, got some feedback from their patient partners as to how much time they're spending, it was probably about 3 to 4 hours, per, monthly event, and so they actually upped it to $150. So, I mean, and I'm also happy to send anyone who's interested the slides that came from that presentation today. It talked about how they formed the group and how they vetted them and that sort of thing, and then how some people sort of fell off, and just the whole personal dynamics of that whole thing. So it's a publicly shared slide deck, and I don't know if I should send this to Mark or somebody, or Crystal. You can route it to folks as needed.
I would definitely love to see that.
Okay.
We would like to base what we're doing off of some sort of best practices or evidence-based something or other.
I know it's hard to know where to start, and I think they're using some benchmarks from the Patient-Centered Outcomes Research Institute, but I think they, we're just going off of hours spent, and they started out with $40-50 an hour, and then they figured out how many hours, and they ended up, as it turns out, hiring them as contractors. And they also said that they would share how they did that as well. That wasn't easy, but anyway.
Yeah, thank you. That sounds great.
Sure. Okay.
I'd love to see that. Wonderful.
Does anybody have any other questions for Ashley?
Thanks all.
Yes.
I just put my email in the chat if anyone would like to follow up with me, and otherwise I'm going to jump off, but thank you so much for inviting me and for holding these sessions. I'm so sorry I have to miss it.
Thank you so much, Ashley. Appreciate you coming on. Thank you.
Bye.
Awesome. All right. Well, and that's what we love to hear. And I know just the speckles of conversations with health equity, social determinants of health, that lived experience that Ashley was talking about with our community coalitions, that I think that there is an opportunity for all of us in our coalitions to be able to invite our, quote, non-traditional coalition members out in our community to give that perception of, or that perceived lived experience, or not perceived, but just an actual lived experience to help us understand what what our focuses can be for their coalitions. So now, welcome and thank you for, again, coming on. And we have a few updates. Unfortunately, Mary and Caitlin are not able to join us. Jill, do we have you on the phone? I think we have Jill's.
Yes, I'm here. Hi.
Perfect. Hi. Do you want to provide any nursing home updates?
Well, I just would like to share that the nursing home team has been busy working with nursing homes across our region, focusing on questions regarding visitation, regarding this outbreak testing, as we're seeing an uptick with COVID cases, mostly due to the Delta variant. We are also working on vaccination uptake in nursing homes. The federal government through CMS has asked us to reach out to nursing homes that have fewer than 25% of residents and or staff who have received the COVID vaccination. And so our team has been working with the nursing homes to think of and address vaccine hesitancy and provide resources and just have additional conversations and sharing of data and ideas for how to maybe move the needle when it comes to the vaccination uptake for the nursing home staff and residents. So we've been busy, all things pretty much infection prevention and control related as of late.
Perfect. Does anybody have any questions for Jill? Any comments? You can definitely put them in the chat if you do. And as far as the vaccination side on the community coalitions, of course, we continue to work heavily on vaccine hesitancy, continue to address that. And now that we have the pneumovax and the influenza seasons coming up shortly, I can't believe it's already going to be August here next week. So as we start to prepare and to continue to vaccinate for COVID-19, we'll want to continue. Oh, Mark, did you want to say something?
No, nope, sorry. Yep.
Oh,
Trying to
you're
do
fine.
two things at once. Yeah.
No worries.
Yep.
So yeah, we're just continuing to support the community coalition work. I know some of you are starting to kind of transition to do some in-person coalition meetings and continue to do hybrid versions, so you can have our members also attend virtually. Please let us know if there's any additional support or concerns or anything like that that we can help find solutions for. So, and then also we have a new Mountain Pacific staff, and we have Ray, and I think Ray, you're on the line if you want to come off mute and introduce yourself.
Okay, can anyone hear me now?
Yep.
Yep, okay. Well, hello, my name is Ray. I joined the analytics team on April 28th, I believe, so still a relatively new face in the department, but yeah, we've made some good headway as far as getting data out to coalitions. In fact, this week we've been working on the community coalitions report for influenza and pneumo vaccines and COVID, so we'll be able to send those out relatively soon. And yeah, just try to get more data out there and fulfill some of those outstanding data requests. So yeah, happy to be here and nice to meet everyone.
Great, thank you, Ray. Yeah, we have some pretty awesome team members at Mountain Pacific, and we're happy to have Ray join our team. So next slide, Mary. All right, and some upcoming events. Mark, do you want to talk about the Aloha Kidney Online series?
Absolutely. So the last kidney series went very well. This is an ongoing series where the information is online, and you have a couple of weeks for each session. There are 6 sessions overall. The next session will be starting in September 12th and run through October 23rd. And these are all different sessions dealing specifically with chronic kidney disease. If you want any information about it, the link is right here, www.aloakidney.com, or you can call 808-585-8404. And we are finishing up the flyer. And so when we send out our next email with all this information in it, that flyer will be a part of it. That's good. Back to you.
Awesome, thank you. Then we also have the 3D Echo series, and so we are having, we're hosting, Mountain Pacific is hosting, and we're having Frontier Psychiatry. And this is a series that's really been beneficial in terms of substance use disorder. We are having folks submit their case studies, and it's a very engaging. The docs from Frontier Psychiatry do a phenomenal job. Previous to this, we had the TikTok series for nursing for trauma-informed care for nursing homes. And so we adore our Frontier Psychiatry docs that come on and help us do these series. So that information too is, hope maybe one of the Mountain Pacific staff can put some of these links in the chat box so folks can click on them and find more information. And then Crystal, do you want to talk about the UW Project First Line?
I sure would. So we are finishing up the last session of the Infection Prevention and Source Control IP Echo program this week. So I want to thank you all who have joined and filled out the evaluations, which were very valuable to us. And so along the way, if you notice that our format was a little differently, we did listen to your comments. So we were able to make this a huge success. And we also put in a few extras to include social isolation, psychological safety, how to speak up at work, and just really feel valued, especially now in the time of what our nursing homes and our facilities and organizations are going through. So that is getting ready to wrap up. And again, I want to thank everyone who has joined and were part of those. And then I also wanted to talk about the family caregiver infection prevention and source control training as well, which we started a couple of months ago with a partnership that AARP thought was worthy of adopting. And so what we're doing is, instead of really hitting these healthcare workers hard, we need to also include the family and caregiver as our team, really. And they really want to know the right thing to do, and they really do want to spread the infectious diseases that are coming into the communities and nursing homes. And so we are doing a caregiver training series one time monthly. And so far, we've had over 300 views on the Facebook channel for that. So again, and that's I think that's not even total yet. So again, that's through AARP Facebook's page, and all you have to do is like it, and I'll put that in the chat. And then next week, fingers crossed, but I'm going to present this and pitch this to CDC and see if they want to adopt the program. So that is it for the infection prevention and source control corner. Alana?
Awesome, thank you. So we definitely have quite a few various events going on through Mountain Pacific, and you can always go to our Mountain Pacific website and click on the upcoming events. And we have a calendar there with hyperlinks that you can click on for more information for these. So, and if anybody has any events or anything that they want to share with the group, please put your information into chat. We'd love to help spread the word. So next slide, Mary. All right, next is Dominic. You're up.
Hi, everybody. Hope you're all doing well. So our initial coalition's report on utilization data has been out for a little over a month, and some good news as Ray, our new team member, had mentioned, we are coming out with an immunization data report. So it really is early days with these reports that we've been providing. The idea is to get everyone looking at their data, thinking about it, starting to think about their data goals, what they'd like to see, thinking about equity, disparity, all those good things. So hopefully you have had some chances to look at your data. I think we even have a couple of polls just to check in with you on this presentation and see if you've had a chance to have a look at the reports or not, and then provide us with some feedback. So I think we're having a chance now to answer just a couple of questions from the Mountain Pacific Analytics team. So we're wondering, have you taken time to, or had time to review the utilization data report? And the second polling question on there is, if you've had some time, are you seeing informative data for your beneficiary population? So that's kind of what we're looking for, just some initial feedback on it.
We're seeing some of these results come in for the polling question. I don't know if any of you have any specific data questions, or in terms of those of you who have maybe seen it, and maybe if you are or aren't seeing informative data, what is your opinion on it?
Yes, we would love to hear any feedback at all. And these reports are for the coalitions. We're developing them on your behalf, and so we really would love for you all to take the lead on developing them. And whatever you think is relevant or you'd like to see. One idea that we just came up with on an internal feedback session is we're going to be releasing a lot of our our larger measures goals data every month with some drill down by demographics, by condition, discharge disposition, type of related data. But we also really want to start to provide you with some kind of inverted reports with some starting with disparity and equity categories. So start there, for example, maybe to race and ethnicity, and then provide related data as a drill down. So looking at the results here, it looks like a lot of us have not seen the report yet or had a chance to look at it. So I hope that everyone has received a copy. You know, if not, I think our account managers have got those. Maybe we can let them know and we can provide them back, or you can let myself know too.
There we go. Got myself unmuted. My computer is being wonky today, not letting me unmute myself. So does anybody have any feedback or questions? Let's see, it says, can you please resend the report or link for access? Is that you're referring to the data dashboard, Danielle?
Yes, I'll just unmute. Yeah, so we're new to the coalition meeting, so happy to be here. But yes, I was wondering if we could receive whether it be the report or the dashboard, so we can take a look. I know we're kind of the not the typical coalition member, so we don't have patient data, for example, but looking at global data would be helpful. Thank you.
Yeah, and just for clarity on what we're doing with dashboards and reports is we're trying to develop a portal, hopefully, where coalition members can log in securely and have access to the Power BI environment, and then see your data right there, go through the maps, do the drill down, export your own reports. So that's taking some time to build and finalize and get there too. So kind of our sending out these PDF reports monthly via account managers is our interim solution. So just one kind of final comment on that upcoming. We have received some feedback already on the type of data that coalitions overall would like to see. So for the next few months, we have a pretty good idea. We're sending out immunizations this month. Then we'll be sending out a report around diabetes, following up with opioids, ADEs, pulmonary, chronic kidney disease, and behavioral health. So that kind of rounds out a lot of the rest of the summer and deep into the fall, and maybe the rest of this year as far as monthly reporting. But we really want to provide some kind of irregular reports focusing on equity and disparity, just to give some insight in there too as we're able. So thank you, everybody. That's kind of all from me. But if there is any feedback, we sure would love to hear whatever you're thinking.
Yes, for sure. Thank you, Dominic. And for those of you who have not seen the data dashboard yet, please reach out to your account manager from Mountain Pacific, and we are happy to get that to you so we can review it. So you have questions, feedback, suggestions on what kind of data you'd like to see for your coalition. I know it's, as we all kind of have shifted our focus in light of what COVID-19 has revealed with basically our nation, with health equity, that comes into play. And how do we capture that? How does that impact the work that we do within our coalitions? So if any of you are doing anything creative or have suggestions in terms of what you're collecting for measures and metrics and things like that for health equity, please share that with us as well. So now, Mark, I'm going to switch it back to you to introduce.
Perfect. I saw Ray on the phone. So Ray, are you and Lisa and T all available right now?
Morning, Mark. Hi. It's me, Lisa. We also have Edna back. We have Charmaine here with Ray.
Oh my goodness, so nice to see you, Edna. Terrific.
Where are you? I can see you.
All right. So Mary, did you put this up? Or Ray, did you put the slide deck up?
Nope, this is ours, Mark. Mom.
Okay. All right.
You want to share?
Put ours up.
Is this easier? Alana?
Yeah,
Just to run from? Yeah. All right, no, you can share. Go ahead. There you go. All right. Well, we're very happy to have one of our partners and one of our coalitions in American Samoa with us today to actually present on their work on COVID-19 vaccines in American Samoa. And really pleased, as you heard, there are a number of team members there who've worked really hard and worked with the Department of Health getting people vaccinated. So we wanted them to share their story with us today. So go ahead, Liza, and take it away.
I'm gonna have Charlene speak on behalf of us.
Do you want this slide?
Can you?
Yeah, I still my feet.
Can we be connected to put our slides on?
Can you share it?
Can we share our slides?
Sure, go ahead. Yeah. Share your screen.
Okay.
Okay, great.
Hold on. Okay.
Can you see our screen?
We're not seeing the screen. We're seeing your screen, but we're not seeing the slide deck. Yeah, you got to stretch that.
Oh, okay.
Now we can see it if you want to just leave it in that mode.
Okay.
Okay. Okay.
So,
Okay, hi everybody. This is Shamae, and I am the fiction preventionist at LBJ, and I am also the part of the COVAX team for LBJ. And we just officially shut our pod down at LBJ. Last week was our last day of participating or helping our Department of Health give vaccinations. We had shut down our original pod in February to get back to hospital operations. And then we reopened again for a month when we started to vaccinate the children 12 years and up. So the data showing is that we have a weekly, twice a week, we have a Zoom meeting with Department of Health and our external partners just to talk about mainly our vaccination delivery, seeing where our numbers are at. We are getting ready to open our borders at the end of next month. So we've been trying really to push out our vaccinations in the villages. So the last the last three days of vaccination that are highlighted in yellow, so July 23, 24, and 26. July, those are the last 3 days that we were reporting for today's meeting. So on July 24, that's a Saturday, that was American Samoa's last village outreach or last district community outreach. I don't think it went as well as what we had hoped because we only were able to deliver 600 plus vaccines total, and we had like five sites open around the island. We've been running into staffing shortages, people not available. Some of our staff and vaccination staff for public health have gone out to the outer islands, so there's a shortage of vaccination, and also LBJ staff have gone back into hospital operations. So it kind of has puts public health at a kind of a disadvantage of, I guess, giving as much vaccines as they had hoped. The next slide This shows our clinic locations, and this is Friday, July 23rd. So our EOB is our government building. And we had this open, these 4 sites all belong to public health. Except for the EOB, that's our government building. And the reason we had a site there is because a lot of our people have to go in there and do government business or immigration clearance. Could I
interrupt for just a minute?
Yes.
Could you move a little closer to Ray? We're kind of getting a little echo.
Is this better?
Yeah, that sounds a little better. Yeah.
How's that? It's right in front of me now.
Okay.
Okay.
Yep, go ahead.
Okay, so the reason for the EOB location is strictly because to help the government work, and it's also the help for immigration clearances for our non-US nationals. So one of the requirements when you go for immigration clearance is that you now have to have your COVID vaccination card on you. So we have a group down there that will actually do your vaccination if you need to go do your immigration clearance. The other 3 clinics, Leone, Taufina, and Amuli, those are healthcare centers belonging to our Department of Health. Our last site there, the Amuli, that just opened a week ago. So it's very on the far eastern side of the island. So they're working at getting the population that live on that side. Instead of them trekking all the way into town, we're getting them trying to go and utilize Amuli. It's kind of been a slow start there, but over the next coming weeks, we're hoping to encourage all that need their first or second to utilize that clinic.
We're still having a little trouble. It sounds like you're underwater occasionally.
Oh.
I think the audio is only coming from Ray's computer, so I don't know if you can move across the table from him or anything.
Okay, I'm gonna move. Okay, so I'm right next to Ray now.
Oh, it's perfect.
Way better.
Perfect. Good.
Do
Yeah.
you want me to go back or just carry on?
What do you think, Alana?
I think we can just carry on if that's okay. And then if folk, does anybody want to go back to a certain slide? Yep, I think we can just move forward.
Yeah, good.
Okay.
We're on the. Yeah.
Okay, so this slide is showing our outreach, and this was, as it says, this is our last village outreach, which was last Saturday. So we have the locations, and these were locations that spread from the east to the western side of the island, and shows the number of vaccines that were given at each site. And then our total for that day was 627. And I think a lot of those sites were open till maybe noon. They had noon time. And we had a lot of our business community also out there at the sites, different sites, with free giveaways and incentives for people who actually utilized the sites on that day. And the reason we're doing the last village outreach is because, as I said, we're looking, well, next week we have our last repatriation flight coming in from Honolulu with, and most of the staff is utilized back in the quarantine centers. And as we gear towards opening the borders, we're gearing all our efforts towards more of the quarantine and home quarantine that will be coming in effect when we open the borders. So 627 was our last village outreach, which just finished this past Saturday. So these were doses administered at the same sites. These are our main sites that stay open Monday, Wednesday, and Friday.
and this was our Monday operation. So as you can see, a total of 234. As I said, Amauli is a slow site as it just got opened a couple of weeks ago. So we're still trying to encourage people to go to that site. Yeah, but this is our vaccine operation for Monday. So these are our total number of individuals, and these are what we call our targeted population with at least one dose of COVID-19 vaccine. At the moment, we are not utilizing Janssen anymore. We actually exhausted our supply. So we're primarily using the Moderna and the Pfizer. So these fully vaccinated, awaiting our second shot. Our waiting for second shot, our past due for second shot is highlighted because it's been a real issue and the numbers are slowly trickling down, that it was becoming a real issue about trying to get people to come in for their second shot. A lot of people just said they forgot. It wasn't until it was required that they needed full vaccination to utilize some of the services on the island that they would come in and get their shot. But I think the numbers have decreased. I think Pfizer has decreased from like 1,400. We're now at 890, and the same with Moderna. Our numbers are slowly trickling down. We do have a call center that they call out to these people and just remind them when their second shot is due. And then the grand total for the amount of vaccines given so far to date is at the bottom, the 28,163. That includes waiting and past due.
Do you mind if I ask a question?
Yes.
Other than just the calls that you do, is there any other approaches or anything else that you do to help folks get back in for their second shot?
Well, we do. We had transport. We had free transport from your village to get to one of the vaccine sites. But I think the call center was the main one, and we had utilized this LBJ when we were vaccinating last year, and we would call up to 2 or 3 days prior your date of return to remind you to please come in. I think what we're doing now is, in the beginning, we used to say that wherever you got vaccinated first, you had to go back for your second. So for some people, it was an inconvenience. So now we're just telling them, if you got vaccinated here, but you live on the west side, okay, these public health clinics are open for you to utilize on the west side. And we're actually finding that that's more, it's more applicable to our people.
Thank you.
Yeah, next slide. So this is the coverage of our eligible participants by age group and shot status. And this was presented today, and it's complete as of Monday. So our age group 12 to 15, our population that we got from our, I think it's the 2010 census, 3,711 of that population. So we have at least one shot on that population. It shows there 47.3. 845 of that age group have completed, and our coverage rate is nearly 23%. Our older populations, their percentages are much higher, as of course they were the population that actually, when we started giving the immunizations. So we're looking at a coverage rate of 67% for all our eligible age groups. Next slide. This is just the pie graph showing. So the big blue is 52.5%, and that's our entire eligible population. We are aiming for an 80%. Our meetings are still geared around how we're going to reach that 80% since we've been nearly 7 months into this and we haven't reached our targeted percentages yet. Next slide. So this is our island, and this shows our coverage rate using the graph. And I think this was May. This was what was shown in May. So we still had pockets on the island with only less than a 35% coverage rate. And then so we have vamped up. We opened more sites on the islands and they did more outreaches since May. So this was in May. And then the next slide, this is by July. So we have eradicated most of the orange sites. That little dot of orange is at one of the far western, very far western villages of the island. I think there's less than, I think today they were saying less than 100 people in that village. So we're actually going to send a team out there and kind of just station themselves in that village and see, you know, we're going to take the vaccination to them instead of having them come all the way into one of the main areas. The little insert of island, that's our Manua, that's our outer islands. And as you can see, they are up in the upper right side of our coverage rate scale. They'll probably be the most protected if COVID got here because they're a boat ride away. And that's it.
You guys did awesome work. Big, huge kudos to your team.
Great job,
So,
Jane.
yeah. So do you feel that the transportation was probably one of the biggest reasons, or what would you say that for the hesitancy? Or
I just think it's mainly our people's mindset. I mean, we have public transport that's readily available for people. I think one of the major we were finding is because we don't have COVID here. So, you know, people are, they think they have time. Oh, we have time, we have time. Our borders are shut down. We don't have COVID. We've had to do some convincing when people come in with questions. And so at the hospital, we were out walking the hospital, like out in our waiting areas when we had our pod. When we were not busy, we would get out there and go into the waiting areas and ask people. And we've had to field some questions, some hesitancy from people about why they did not want to get the vaccine. Yeah, so we actually, basically we pulled people into our pod. Did some education with them and you know, we got some really good responses. And I think that's one thing lacking in our villages response is that we set up a pod, but we don't, there should be an ongoing education part, you know, wherever we're set up, that people can come in and kind of come sit over here if you're hesitant, or come here, I can answer your questions. I think people are our people are just kind of shy to just come in and ask questions, and they're expected just to come in and get your shot without asking any of the questions that they have. So village response has been okay. We have a raffle now. We have a vaccine raffle. So every week, all those who were completed with the 2 shots, all their names, all the age groups goes into a drawing, and they randomly select numbers. Ray is one of our committee members on that raffle committee, and split up the age groups, and they win money prizes. So we kind of saw a little increase of people, probably because of that. But But I don't know if Ray, maybe Ray might want to comment if they've seen an increase the vaccinations because of the raffle.
Yeah, we've seen a lot of interest. We've been getting a lot of calls, and we've seen a correlation in some of the numbers, in some of the sites, especially with those that were waiting for their second shots.
Yeah.
I think a lot of them came back in because they were told that their names would be entered and won't be entered until they get that second shot. So we saw an uptick in that, but
Yeah.
I think it sparked a lot of interest, and a lot of folks did come in to try to get their shots. So there was some good in having that incentive for the folks to come in and get their shots.
Awesome. Well, yeah, I definitely agree of meeting people where they're at in terms of understanding and educating about the vaccines and the importance, and just using those creative ways, those drawings. I've heard, I know our Guam team talked about, they were, I think it was Guam, correct me if I'm wrong, Mark or Maggie, but the giving what, 3 cars away now?
Yeah, Agnes, or yeah, there's Glynis.
Linus,
Yeah.
Linus is on.
I think there were 3 or 4 cars given already plus cash. So, but we still haven't met our 80%, barely. We had the July 21st that was set by the governor, 79 point something. So we were extended.
Awesome.
But people like those incentives.
Yes, they do. And we just got to keep keeping on with that vaccine push. Just, you know, we definitely need to. And I think with the Delta variant, I know the last percentage, and I guess maybe somebody can explain this to me at a different time, but you know, I think one of the statistics is it's like 224% more infectious than the regular COVID variant, which is mind-boggling to me. But I mean, just to the point that, you know, we can't let our guard down. We got to keep these efforts going. So good work, everybody. Perfect. Thank you, Mary. So does anybody want to have any success stories, anything they'd like to share, any questions? Talk about what's going on in your community coalitions, what's some big issues. I know in Montana and Wyoming, we've definitely talked about the workforce shortage and how that's really impacting a lot of everybody's work, not just healthcare industry, but just our economy in general. Bueller. Any questions, comments? Are y'all having trouble with your chat like I have, or my mute button like I have today? My cursor on my computer just keeps like zipping across the screen. It's like possessed.
Alana, it's Eileen from Wyoming, and I just wanted to comment that I'm very excited about the data that's going to be coming out and having availability of data. I think for my groups, one of the things that's caused us to have a little bit of trouble moving forward is just finding something to sink our teeth into within the absence of data. So really excited about the new system and the new analytics team and everybody that's working towards getting us some great data to utilize.
Yeah, thank you, Eileen. Yes, we are very excited to have that available. And, you know, I think to Dominic's point of, you know, just feedback and what are you needing in terms of putting this, layering some data on top of the public source data that we already get, to be able to build these dashboards for you. And it helps to really focus what you need to, or what you can do, or what is a coalition project for your group. You know how Ashley had shared that kind of a spinoff on their coalition essentially is to create that health equity coalition. And I know other coalitions have formed a sub work group or an affinity group, however you want to coin that term for your coalition. But maybe there's just a few of you that want to focus on one specific topic around that. And we're definitely happy to help facilitate that, provide resources. And one of the other things that we're helping to do with Montana and Wyoming is we're pulling a couple different partners and organizations together, AARP and the Geriatric Education Center, Geriatric Workforce Enhancement Program, GWEP, those kind of folks, and working around age-friendly health systems. And as I had asked earlier, what matters to your community, that's some of the language that we use with the IHI age-friendly health systems. And so definitely be hearing more from us around that work as well. So I see that Mary put in an evaluation link. If y'all could take a minute and just fill that out for us, we'd greatly appreciate it. And if any of you have any specific topics, focus questions, anything that you want to see for our next regional quarterly call, which will be, somebody help me out.
October 26th.
Thank you, October 26th. Seems so far away, but it's really not. Right before Halloween. And of course, you can register in advance for that and share this. If you have other coalition members that maybe didn't know about it or would like to join the next one, please send that information. And again, if any of you have any data questions or just looking for specific resources, we would love to help be that conduit for you, get you what you need. So reach out to any of your account managers from Mountain Pacific.
Thank you.
Thank you, everybody, for joining today. So appreciate your time.
Thank you.
Hello, everybody.
Thank you very much.
All right. Thank you, guys.